we have Dr. Victor Baquero here with us live. Thanks for joining us, Victor, and
Thank
all
you,
you
Dr.
do.
Fishman.
I'm going to ask you the really hard question first, okay? And that is what I think everybody's probably wondering who just heard your talk, which is, how do I get my primary care doctor to do what you just discussed? How do we get out of that box of the disease response system into this more wellness discussion we all need to have with our doctors?
That's a great question. And I think, one of the best things I like about this program is the focus is to start training doctors how to learn about nutrition and lifestyle, which is something we're not getting at all. Even my partners, at lunchtime, I see them eating Doritos and chips and full on, sugar drink. They're overweight and taking a lot of medicines themselves. So it's not something that is really in the mindset of most physicians. And that's something that is coming along. Doctors are learning more and more of the benefits, as the public is, but it is still going to be a challenge looking forward.
Yeah, thank you for the pitch, because we are going to be taking what we do here with consumers and looking at the competencies, the goals of the education we give to our health practitioners, and try to not so much take the focus away from disease, but expand the focus to health and prevention. And Dr. Baquero is one of our champions. So if we now kind of pivot over to, more of these finite areas of wellness, you spoke about kind of lipids and dietary cholesterol. And, there's a lot out there about, the badness of some foods, and yet some cholesterol may be good cholesterol. Cholesterol that's in our blood is really not all that affected by the cholesterol we eat, or we hear just the opposite. Can you comment on that?
Right. There is a lot out there in the media that will contradict statements said by experts. Bottom line is, yes, the more cholesterol, especially LDL cholesterol, is the bad player. But that's just part of the story. There's more to that. The LDL comes in two forms: type A, which is the large fluffy cholesterol, which is not so bad, and then type B, which is small dense, which tends to get into the arteries more. There are other subtypes like ApoB100 and lipoprotein A, which are also small, dense forms of LDL that get into the arteries and cause heart disease. So there's more to the picture. When we first started checking cholesterol, we would just check total cholesterol. And now we know that that's not entirely the whole story, because you can have a lot of good or healthy cholesterol, the HDL, and have a very high total cholesterol and not have any heart disease. So usually when we're exploring a little further, I will talk to my patients about getting a more advanced screening test to look at these subtypes of cholesterol. And there we decide if they have a lot of the bad types, or if they're unfortunate to have lipoprotein A levels that are really high. That goes onto the genetic disorders category. And those patients we need to look at a little closer, since many of those will have heart disease in their 40s. But they're not aware because they're not looking at the whole picture.
So again, focusing on molecules, you talked a lot about sugar and glucose, but what about people who are trying to avoid the inflammatory toxic effects of too much sugar by consuming large amounts of sugar substitutes? What's your perspective on that?
Yeah, at the end, what I try to guide my patients is towards eating more of a whole foods diet, trying to find substitutes that are not entirely natural. Will complicate things. Sugar substitutes in themselves can cause problems to the microbiome, as we talked about. Some have been labeled as carcinogenic. They don't necessarily promote good health, as would eating a more whole foods diet that gives you sugars in a natural setting, but that sugar is usually bound to fiber. It's not going to be absorbed immediately, little by little. In fact, there's interesting studies. A study on diabetes, giving people a load of sugar with diabetes, and giving the other half of the population with the same condition the same load of sugar and a cup of berries. Now, you think the ones that got the added sugar from the berries would have a larger effect on the blood sugars, and the opposite happened. Their A1Cs were lower. There was an insulin spike that was reduced when you added berries to the diet, to the high sugar load. So it's again, eating more of a whole foods diet will tend to normalize things. When we try to add substitutes, things get a little more wonky.
So with that, you mentioned the microbiome, and there have been a number of questions, not just with this session, but with others, about understanding this, this major gut immune organ of ours and the interaction, playing nice with all the bacteria that are living within us. What do you see as a pro-healthy microbiome diet? What do you think of adding pro or pre or postbiotics? And then what about antibiotics?
Okay, so let's talk about antibiotics first. Antibiotics obviously are meant to kill bacteria, and in doing their job, they will kill the bacteria in our gut. The effects of antibiotics are varied. We as doctors are very aware of using the very strong antibiotics and the consequence of developing colitis or C. diff, which is an overgrowth of this bad bacteria. There have been interesting studies. In fact, I was part of a study looking at doxycycline, which is an antibiotic we dose almost daily for the treatment of acne in teenagers. Some of the antibiotics, like quinolones, which Cipro is a commonly prescribed one, and clindamycin, will mess the microbiome, will really affect it, and it'll take a whole year to get the microbiome back to normal. Other antibiotics like penicillin or amoxicillin, it may take 3 weeks to get your gut flora back to normal. So depending on the severity of the antibiotic, the microbiome can get affected more or less. So it takes a while. In terms of keeping the microbiome healthy, I really promote the use of prebiotics, which are fibers. Your gut bacteria feeds on fiber. It turns the fiber into short chain fatty acids, or SFAs, which then keep your gut healthy. So the more diverse the fiber consumption, the better. The more colonies of bacteria you're going to promote, which are your probiotics. So instead of telling patients to consume more probiotics, I usually encourage them, get a diversity of fiber-rich foods in your diet. I encourage them to consume at least 30 fiber-rich foods per week. So that's vegetables and fruits and legumes and nuts and seeds and grains and cereals. And that will help promote a nice group of bacterial colonies. And therefore, you don't have to consume probiotics. In fact, in an apple, you will have 100 million probiotics. They'll be in foods themselves. That's how we make sauerkraut. We just put a little salt and mash it up, and the probiotics in the cabbage will produce sauerkraut. So most of the foods out there have their own probiotics. If we consume diversity, we'll enhance our microbiome.
So should everyone get a dose of sauerkraut at the end of the antibiotic course?
So the studies are mixed here, but it doesn't hurt to consume your probiotics, whether it's kombucha or sauerkraut or kimchi or kefir. Any of those foods will help give you a load of healthy bacteria. But I also recommend get your good sources of fiber, because that will also promote the normal microbiome.
Victor, in the few moments that we have, we've had a number of questions on sleep. I suspect we could have you here for many, many more hours talking about sleep. But just as the last question, what do you do for your patients who come to you and say, they're insomniac and want to make a lifestyle change rather than a medical change?
Right. That is a very, very common, almost daily question. Our lives are very busy. We have so much going on, and then we have all the screen time and a million things that we do during the day that we try to pack it in before we go to bed. There are a lot of different solutions. There are some things we can take, but a big part of it is the things we do the hour before we go to sleep. I have recommended, I'll put a plug here for a book that has been very effective for my patients. It's called Energize by Michael Bruce and Stacy Griffin. And this is something I'll commonly recommend to my patients. It's more of a approach to getting the sleep back in order. It determines your chronotype or your sleep type and your body type. And then you go to the section that tells you exactly how does your body function best. We are genetically essentially programmed to have a certain chronotype or sleep type. And this book optimizes your daily workflows and patterns to get your sleep back in order.
Well, Dr. Baquero, thank you so much for all you do, for the work you are providing your patients, and the leadership in taking UC Davis forward really on the ground. You're walking the walk, and I know you have incredible plans for our new facilities in Folsom that will really embrace the vision that you have for healthcare. So more to come, and thank you for being with us.
My pleasure.